Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. We share health information to help you learn more about your body and live better. Menopause means the end of menstruation and is that time when a woman gets to the end of her reproductive cycle. Here are some of the things that happen when you reach menopause. The amount of reproductive hormones like estrogen your body makes starts to go down. Your ovaries stop releasing eggs regularly. You stop having regular periods. And when you have not had periods for 12 consecutive months, we say you have reached menopause. Menopause is technically not a health condition. Many women come to this stage of their lives without experiencing any problems. However, a small group of women can experience distressing symptoms before, during, or after menopause. Please check out my video here to learn about menopause symptoms. Many women are likely to start the transition into menopause from the age of 45 years upwards, and most will reach menopause around the age of 48 to 51 years on average. And when it comes to sex, many things around menopause can lead to bleeding problems. Let's look at 3 of them. Number 1, no desire for sex, possibly due to culture, a busy life around family, work, stress, and so on. This can happen as a woman grows older or approaches the age of menopause. Some women believe they cannot have sex or even enjoy it as they grow older. It may be a cultural thing where a woman has been conditioned to believe as she's grown older and dried up, she cannot enjoy sex. That mindset might also come from pressure at work or business, and being a busy family member, caregiver, or supporting the family, and so there is no time or little time for sex. A woman can also have a reduced sex drive or desire for sex, and this can be as a result of conditions like depression or low mood. Of course, mental health issues can happen at any age and are not necessarily associated with menopause alone. Whatever the cause is, this lack of a desire for sex can affect your sexual encounters. Women who desire to have sex become aroused during foreplay, and this builds during intercourse. From arousal, your body makes lubricating fluids which moisten or wet the vagina, making intercourse easier and more enjoyable. If this is absent, the friction that happens during sexual intercourse can lead to bleeding during or after sex. And number 2, the effect of reducing hormones in the body like estrogen. Here is another factor that affects the vagina as well. Estrogen is the hormone that keeps the cells of the vagina, the tissues of the vagina, plump and healthy. As estrogen reduces during menopause, the cells of the vagina become thin or they shrink. Essentially, this means that the vagina itself becomes drier and thinner or can shrink. This condition is known as atrophic vaginitis. It makes having sex painful and can lead to bleeding during or after intercourse. To learn more about these and related conditions, check out this video here on 15 causes of painful vaginal sex. And number 3, the risk of specific health problems as a woman grows older. This means that conditions like cervical, womb, or vulval cancer become more common as a woman grows older. The changes in the health of the tissues or the cells as the cancer develops makes bleeding after intercourse or sex one of the symptoms of these cancers. Certain skin conditions can also fall under this category. One of them is called lichen sclerosis. 4. Sexually transmitted infections can happen after menopause if a woman is exposed to the germs from her sexual partner. So how does the postcoital journey in menopause run? The usual story is when a woman who has stopped having her periods suddenly develops bleeding after having sex or during sexual intercourse. The bleeding may be heavy or light like spotting, and the bleeding may happen with or without pain. There may even be other symptoms like a vaginal discharge or itching. All of this should prompt a visit to the doctor. They will take a lot more information from you about everything that's been going on and arrange a physical examination. These symptoms mustn't be ignored, please. Remember, we said that at menopause, certain conditions like cancer are more common. So we must arrange tests to see if the cause of the postcoital bleeding is from serious causes like womb cancer or cancer of the cervix. So the assessment or the journey starts with the doctor's questions to explore the symptoms and then a physical examination. Some of the questions are: how long has the bleeding been going on? If a woman has reached the age of menopause and has been experiencing bleeding after sex for up to and over 4 weeks, we will have strong concerns about cancer. Next, are you up to date with your smears? Have you had previous abnormal smears? And if you have, what treatments did you get? Has there been any loss of appetite, weight loss, or night sweats? We will also ask about sexual partners, because any person having sex with a new partner or more than one partner is at a risk of a sexually transmitted infection. There are several other questions to cover, including your medical background, any other medical conditions you might have, previous gynecological problems or pregnancy-related issues, your medication, and so on. The physical examination will involve an intimate examination of your vagina and cervix using a speculum. This may reveal skin conditions I mentioned earlier, like lichen sclerosis. The examination might also tell us that the vagina is atrophic. In addition, we may be able to see changes in the vulva or vagina or cervix, for example, ulcer or other abnormalities that indicate something unusual is going on. Depending on the initial findings, the next step can include arranging a pelvic or abdominal scan or a direct referral to a gynecologist for more specialized tests. This can include a camera test to visualize or look closely into the cervix and the womb, taking tissue samples from those areas, these are known as biopsies, and other tests to identify if cancer or some other cause is present. The treatment will vary and it will depend on the cause in each case. And this is the summary of a journey into the cause of postcoital bleeding after the menopause. Ladies, the key takeaway is that it should never be ignored. It is vital to establish what is causing this bleeding. Many times the cause can be treated, whether it's from an infection, whether it's due to atrophic vaginitis, if it's as a result of friction because of a loss of libido, whether it's due to stress, mood problems, or something else. They can be treated. Detecting cancer and treating it early is extremely important, and why we encourage women not to ignore this symptom. I hope you found this journey guide useful. We're developing a playlist on postcoital bleeding, so make sure you browse it for any more information around this topic. Give this video a like and don't forget to hit the subscribe button. You can send any inquiries around this topic using our email health information service. I will place the links in the description box for you. If you found this video useful, this other one on the doctor's approach to treating heavy menstrual bleeding might also be interesting. So please go and check it out, and I'll see you in the comments.